Hi, everyone. Mandy Ashley with the Aurora Health Alliance. This is our spring quarterly community meeting and my first official big meeting back from parental leave. I'm also driving these slides, so please treat me with a little bit of grace as I transition. First and foremost, I want to thank our affiliates, our sponsors. AHA couldn't be who we are and provide the programming and meetings that we do without all of their support. Please feel free to introduce yourselves in the chat. We'll also be doing sharing resources throughout the meeting in the chat box. So if you have any questions there, you can use the chat box. We're going to start with our Did You Know panel. That is listed on the slides. There'll be 4 panelists. The last one will transition that to discussion groups. So our first Did You Know panelist will be Jamie Sorrells, speaking about protection and resources around fraud. The second will be Angie Gonzalez with the All of Us program. The third is Frank Butts with the City of Aurora Economic Development, talking about food security. And the last is Danielle Loeb, Dr. Loeb, with speaking on homelessness. So I did not triple confirm that, Jamie, that you're on. Are you here?
I'm here.
Okay, perfect. I have all of your slides, so when you want me to advance them, let me know.
Okay, so are we going to jump right into it now? Okay, I guess we are.
So you can do some sort of segue, fluffy segue. No. Happy Wednesday.
No, well, happy Wednesday to everybody.
Thanks.
Anyway, thanks for having me. So just quickly, and you'll see this at the end, once again, Jamie Sorrells with the District Attorney's Office for the 18th Judicial District, which is Arapahoe, Douglas, Elbert, and Lincoln. And I'm Director of Consumer Fraud Protection. So the next few slides and then my comments are going to relate to things along the lines of consumer fraud, protection. So on the first slide right here, I will first note this, though, that the majority of scams and fraudulent activity that we all face on a daily basis in our personal lives, even in the workplace, most of these are things that have been around for quite a long time. There's not a lot of new. The technology makes the twist a little different, but these are old scams or activity, but the environment around it can make it seem a little bit different. And so the pandemic has been a moment in time where fraudulent activity really surfaced in a very high level and high degree. A lot of things related to COVID and to the economic downturn. So those scams, types of fraud have been out there. What I really want to point out, though, is the human side. It's the position that where you sit and where I sit. So much of which way the needle is going to go really depends on you, no matter how good they are, because it is organized crime, just about most of the situations. It really kind of comes down to you. So this statement right here is very, very true. The vast majority of these cyber attacks and fraudulent events really involve preventable human error and around behavior weaknesses. And so that's pointing to you. What I mean by that is that, we get our software in place. We have our antivirus software. We put the firewalls up at work and on our personal devices. We can be very good about being diligent about changing our passwords and what have you. But online security is so much more than just that. There's this human side that I'm talking about. And really what I'm referring to is understanding the awareness that you have on where you are through the course of the day and weeks and moments of your life on an emotional and a behavioral standpoint, because it really does matter. Because depending where we are, it definitely alters or has an impact on decision making. And this could be true in online purchases or just making purchases in a store. But it's also, do I give the information that I'm being asked of, whether it be a phone call, or do I not? So it's really understanding where you are at that moment and how you act. So I hear all the time, one of the many roles or hats that I wear at the DA's office in relation to economic crime and the consumer fraud protection. I answer the hotline calls, the complaints that come in from folks if they believe they've been a victim of that type of crime. And over and over and over, I hear, I knew better than to do what I just did. And that's probably true. And so I hear this, and often I'll ask them, like, well, so why did you do what you did? Why did you answer that call? Why did you answer it the way you did? Why did you click over or what have you? And so a lot of the conversations I have, we can kind of backstep and see kind of where they tripped. And that's really what they did is they tripped. So I hear that all the time, I knew better than to do what I just did. And a big part of this, what's happening, these calls that we're getting, these emails, it's all part of something called social engineering. A lot of us have heard that term before, and it does exist in spaces other than online and consumer fraud, but it's social engineering. And really what social engineering is, it's a series of psychological manipulative techniques that exploit human errors and judgments in order to direct people into performing certain actions. They're trying to take you from here to here. And often what happens in this space is people end up revealing sensitive personal and financial information. It may go so far where money is extracted from you, where you willingly forfeit that money over in a range of different ways. So that's really what social engineering is. So once again, what I'm trying to say here, it's the you in the equation that really matters, most. It's considering the degree of choices and responses and how we purchase and social and business circles that we're involved with on a daily basis. It's the you in this that's going to decide which way. So, and what I really mean by this, and it's as basic as it really is, it's kind of like a 101 statement. And we tell our kids this, and our parents have told us this, and what have you. But really, it comes down to your own personal experience on how you react versus how you respond. Are you reacting? Or are you responding? Specifically, it's the how, when, where, why, and under what circumstances do you find yourself in a reactionary state of mind versus a responsive state of mind. And if it's an email or a text that's coming across to you from supposedly your bank or financial institution or the IRS, Social Security Administration, SBA, if it's that format, the text or the email, that split second that you click on that link that's there is going to determine, a very substantial, potentially very substantial, outcome. So as basic as it is, a reaction is something that's instant. It's something that's done on impulse. Reacting is a good thing. It's what's helped our species to survive for thousands and thousands of years. But is it always the appropriate action to take, the fight or flight? So it does protect us, but in matters of what we're talking about today, it really doesn't. So the more reacting we do, the less empowered we really become. So a response is really, it's more of it's something that's thoughtful. It's done with a degree of reasoning behind it. It's taking that additional time to make decisions, to address the long-term benefits. Even if it's a call that you're having, it's your choices. If you take a responsive approach, you're stepping back and you're looking at the bigger picture. And keep in mind, a lot of these solicitations that come in, whether they're coming in to your employees or you as an employee or at home, anytime that it's something that has to be immediately responded to, if there's a sense of urgency, it's a huge red flag that should indicate that this is a scam. This is fraudulent activity. This is organized crime at your doorstep on your phone. trying to talk to you. So responsive approach, the best thing to do is to take a step back, catch your breath, question. They hate it when you question, research, and understand. So an example of this is, I'm going to tell you right now, if the IRS calls you on the phone, it's okay for you to hang up, because they don't call you. They always reach out to you via US Postal. But hang up and you do the research and understand if really what they're telling you on the other side is legitimate or not. You have the means to go to the secure sites, the legitimate sites, and determine. So wanting to respond versus react be the difference between falling prey to a scam or actually outsmarting scammer. So next slide, please.
Is this the correct one?
My screen still has, let's see, there we go. Okay, so so I said what I said, and please hold on to that. Here's some traits right here. Now this is consistent with what we're seeing in our office when I talk to my counterparts in other districts. This is from AARP. They just put this out, but these are typical personality traits which leave you, we found, be more vulnerable to fraud. And so the first one is you have a high respect for authority. This is especially true for us Gen Xers and boomers. Hate to throw those out, but the older population tends to have a higher regard for authority. So when the IRS calls, so if a federal agency calls like the IRS or the SBA or Social Security and says you've got back taxes that are due, that there's something wrong with your Social Security status, therefore your benefits are going to be frozen until it's resolved. Lately, we've been getting a lot of stuff from local law enforcement agencies where the numbers have been spoofed. The Arapahoe County Sheriff's Office is calling you to say there's a warrant out for your arrest unless you pay something, or down in Castle Rock. A lot of this older generation has a higher respect for authority, so therefore we've found quicker to provide that sensitive information that they should not be giving over. So it can be personal information, it can be financial information. Also, if you're someone that likes to please people, kind of ties into the authority, but we've had a lot of situations where supposedly the minister or the priest of church is sending out something to their congregation saying that we need to help the congregation, you need to go out and get gift cards to help. One is that empathy that we have as a species, and that we really do want to help, but there's also someone there asking us to do something good. So we like to please people. So in doing so, and these scammers are good because this is what they do all day, every day. They're marketing call centers out of India and Nigeria and Jamaica, what have you. They know what to say, and they can tell pretty quickly if you're someone that likes to please somebody. If they've been farming you off of social media, they're definitely going to know what makes you tick. You're overly confident. People that are cocky are very prime victims of fraudulent activity and scams. They think that they can never be tricked, and therefore they miss these subtle little questions that are being asked of them or to them. And often we found that they give a degree of information that they should not. If you've been scammed before, there's a good chance you'll be scammed again, because the way it works in the dark web, this is a huge network of entities that talk to each other regularly, and they sell your information for years. So like a data breach could have happened 3 years ago, and just now your information is being utilized in a fraudulent manner. Some of these unemployment benefit issues that a lot of people in our state are experiencing is from old data breaches from several years ago. Some are current data breaches. But your information gets passed around. So if you're the person also that never answers the phone for an unsolicited call, or an email, and you keep getting them. And I've had people say, I've had it. I picked up and I told them they were a scammer and I knew what they were doing and not to call again. When you do that, you become very popular in that world because you're someone that's going to answer the phone. And if the right scammer says the right thing at the right time, there's a good chance they're going to be able to scam you. If you're overly friendly, they know how to manipulate you, whether it's romance scams or things that helping, an individual or a certain population. Sadly, our country is experiencing a high degree of shootings. So there are a lot of charity and donation entities collecting funds for individuals and groups. A lot of these are bad. Very few, I mean, a lot are good too, but they're playing on your friendliness to want to help. If you're under stress, obviously, if your head and heart are in a different place, they're going to be able to take you from point A to point B. Same thing if you're lonely. And so I think you can see with this, definitely during the pandemic, how a lot of us were going through a lot of these things and or exhibited these types of characteristics. So keep this in mind. These are, there's a little bit of all of us in each of these. Okay, next slide, which is the last slide. Other than my information. So in a nutshell, there's so many things to throw out, but keep in mind, first of all, what I said in the beginning, it's, 95% of what's happening out there, it depends on you and you making the right decisions. It's based on preventable human error and behavioral weakness. But basic things to observe is, really, hopefully you're doing this, ignore those unsolicited emails that seek immediate action. Nothing needs to happen quickly. And if you get these at the end of the day, of a work day, and definitely on a Thursday or Friday, and you have to act now, hang up. Hopefully you didn't answer it in the first place, but nothing's that immediate. Slow down. I talked about that. Take time to read the emails. If it's a charity, go to the Secretary of State of Colorado's website, see if it's an entity that actually exists. Think about what's going on. Understand manipulation. This is all ages. Just understand what it is, especially online. Is it a demand or request? Once again, a sense of urgency. Research, vet it out. Make sure you are talking to the IRS for sure. Never go to the numbers that they provide you on a phone call, text, or email. And with that, do not let the link be a control where you land. If something's unsolicited and coming in, you don't click on those links. We had something last spring where Target, which was not really Target, sent out text to a whole lot of people. It was, folks from overseas saying Target recognizes how hard the community is being hit by the pandemic. We're giving everybody $175 in free groceries. Click here. And you clicked on it. It loaded some bad software, which then allowed them to read your touch strokes. So as you moving forward went in and put in passwords and IDs, it read those touch strokes. And they had plenty of information to do a lot of good for them and damage to a big part of the population. And the last thing, as I covered in the beginning, take a responsive approach always rather than a reactionary one. Think and analyze before you act. Once again, it's okay to hang up on the police department that's calling you up and saying there's a warrant out for your arrest right now. You need to make this payment right now in order to avoid that. Excel calling you up and saying we're going to cut your power because you owe $2,500 in back payments. Clearly you've been pretty good about paying, because we had that recently. Excel was calling people and people were going out and getting gift cards to make payments to Excel. So that's all I really wanted to share. The next slide is my information. So, once again, with the DA's office for the 4 counties, the 18th Judicial, which is our district, your district, there, if you are the victim of, if you believe you're a victim, there's my number for the hotline, and there is my email. And then if you'd like to set up a presentation or the like and go deeper, then down there it says presentations, and there's my direct email. It's just J Sorrells, and the same email address as everything else at our office. So that was a lot. Are there any questions for me, or how would you like to handle questions? You can email me
Yeah,
after the fact.
I have actually a question. Is there any, so we have a lot of community outreach folks at this meeting that can take things back to either, people in the community that they're helping assist or with their coworkers and whatnot. Is there any like resources that they can share directly with like a poster or a website or whatever?
So once again, reach out to me. That they're
Okay.
all the fraud alerts, excuse me, that I have out there, and my predecessor before me. If you go to our website, which is DA18, so David Allen 18 at org. If you go to our website, it's all about our office. But if you go to the consumer fraud section, you'll find it. There are PDF fraud alerts and advisories out there. For example, I just put one out on the charity and donation scams because of I reference Boulder, our friends of Boulder. There's things on child ID theft. There are things on youth scams. It's the season for contractor fraud to really ramp up. There's a lot of contractor fraud. So there's simple little one-page items there. If I would be happy if you wanted to reach out and you would like to partner and I can create some collateral for you as it relates. I have a travel group that wants me to talk about travel scams here in about a couple of weeks. So I'll customize it and blend some things in there and some resources. And that site on our website as well, you'll see another page with a long list of resources of things within our district in the state that you can tap into depending on what your need is. But you can also think of me as a concierge, that I am, because we're tied into all of our law enforcement partners. I could be happy to direct you different directions.
There are a couple of other questions that have popped up in the chat, but I just looked at the time. We have 3 other panelists and some discussion groups. So are you okay if folks reach out to you directly? You said that was fine.
They can.
Okay.
I can also go through and try to reply on the chat to some of these people directly.
Yeah, if you don't mind, that would be so helpful.
As I'm listening to the other speakers. So.
Oh yes, no multitasking allowed on this Zoom. Thank you.
All right, so thanks a lot.
Thank you. I told you I was easing in. I put myself on mute and pulling up the next slide. Next, we have Angie Gonzalez with the All of Us program to talk about diversity with research, clinical research. So thank you.
Hey, thanks, Mandy. Hello, everyone. So my name is Angie Gonzalez, and I am with the National Institutes of Health's All of Us research program. So today, I'm going to just briefly talk about not only improving healthcare through research, but what the All of Us research program is, how you can get involved, and how improving the future of health can start with you. So thank you, Mandy and AHA, for having me part of the Did You Know panel and taking the time, all of you for taking the time to learn about it. Because I'm sure that there are a lot of people who don't know about us. So I want to start things off with a poll question. So you can either just raise your hand or use any emoji. How many of you out there think that high blood pressure is something that can be passed down from one generation to the next? I see some hands and nods. Yes. Okay, so if you chose yes, you're absolutely right. High blood pressure can be hereditary, which means it can be passed down from one generation to the next. And did you know, it's shown that non-Hispanic African Americans are 40% more likely than non-Hispanic Caucasians to have high blood pressure, and they're less likely to have this condition under control. And on a personal note, high blood pressure runs in my family. My mom and my uncle both have it, and I know that this cycle will only continue unless we can get the research done to get some questions answered. Okay, next poll question. Who wants their medical providers to give solutions and treatments that are specific to you as an individual? Go ahead and use any emoji or wave. Yes, thumbs up, everybody. So it looks like the majority or almost all of you agree with this. And so do we. Next slide. And feel free on this next slide, everyone, to go ahead and get your camera or QR code reader out, and you can scan the code you see here on the screen so you can open it up as I move on. Okay, next, did you know you can help make a difference in speeding up research and improving the health of our communities? Yeah, well, you can. And before I share information about the All of Us research program itself, I just want to set the stage by providing a little background on health research. So health research is the process of finding out new things about improving people's healthcare. And people who conduct health research are identifying better ways to keep us all healthy. This is the foundation of the All of Us research program. Did you know that the All of Us research program is part of the Precision Medicine Initiative, which launched in 2015 and is led by the National Institutes of Health? The goal of All of Us is really to provide researchers with information that might help them understand more about why people get sick or stay healthy, and to advance precision medicine research, which I'll talk on in just a few minutes. The program aims to engage a community of participants that really reflect the diversity of America, including many people who haven't taken part in medical research before. So participants can be of any background, gender identity, sexual orientation, and health status. You can be in a rural area, low socioeconomic status, or really reaching out to all of those underrepresented communities, because health research can really only help people of all backgrounds if people of all backgrounds get involved. I'm half Puerto Rican and half Cuban, and as a Hispanic female, I'm part of that underrepresented category. But I feel that this program kind of gave me a chance to be included and to have a voice representing my community in research. To date, we've got over, I want to say 376,000 people who've joined, and our goal is to get to 1 million or more to create a database that truly does reflect the diversity of America. So back to precision medicine. What is it anyway? So precision medicine research considers the things that make everyone unique. It's also just a fancy way of saying research on healthcare tailored to you as an individual. Remember the poll from earlier? It basically focuses on the differences in our environment, like where you live, our lifestyle, like what you eat, and biology, your genes and family health history. A great example is I have a twin sister, and even though we're genetically similar, I swear by one allergy medicine and she swears by another. What works for one person might not always work for another, but yet we're all kind of treated in this one size fits all approach. So studying these differences, researchers may find patterns, and this may improve health for everyone. Go ahead and use any emoji if you know someone, and I know we're all looking at Mandy right now, who wears prescription eyeglasses or contact lenses. I know I do. Most of us do, right? Did you know that about 14 million people in America, age 12 and older, have self-reported visual impairment, which is typically defined 20/50 or worse? Prescription glasses, hearing aids, prosthetic limbs, they're all common examples of precision medicine. They're basically custom solutions to an individual's needs. And sticking with the did you know questions, did you know that more than 80% of all of us participants are from underrepresented communities in biomedical research? And not only that, but more than 50% of that 80% are of racial and ethnic minorities. And the All of Us research program is already bridging gaps in health research with this statistic, as well as having more women participants than men. So at this point, you might be wondering, what's in it for me? Well, it's simple. You'll get to contribute to research that might help future generations. You'll also receive health information back that might be useful to you in the process. We do give back ancestry information as well as DNA information, which is kind of nice. I recently got back my first round of results for my DNA. So you'll find out if you're genetically predisposed to something. So it's definitely something to look forward to. Remember, There's no one out there that's exactly like you. You know, I mentioned I have a twin and even she isn't exactly like me. By participating, you'll also have an opportunity to make an impact on the current COVID-19 research. If you're looking for ways to support the work, we do antibody testing and electronic health records collection. And all of us participants may be able to support both of those efforts. Health research has never felt more urgent than it does right now. And we all have a chance to be represented in research that can benefit us all individually and collectively. The All of Us research program is dedicated to better health, both in the future and today. So now I'm hoping you're wondering how you can get started. Well, you can visit the All of Us website at joinallofus.org/connect, which I will drop in the chat for everyone. That's where you can learn more about the program, sign up to receive our newsletter, or you can enroll. The other option, which is my preferred option, was to download the All of Us Research app in the Google Play or Apple App Store. Please be sure to download the all white one with the white background. It's created by Care Evolution and it's called All of Us Research. Okay, if you didn't get a chance to scan the QR code earlier, oh, I think I can switch slides. I forgot that was there. You can go ahead and scan this one. So All of Us is one of the largest active data collection efforts out there. And together we can help make a difference in speeding up research and improving the health of our communities. If anyone has any questions, feel free to drop them in the chat and I can do the same thing by answering them. I just want to thank you all for your time. Hope you guys enjoyed the quick presentation on All of Us, and don't miss out on your chance to help change the future of health for all of us. Thank you, Mandy.
Thanks, Angie. I was multitasking a little bit. I pulled it up on my phone. Can you see? There you go, All of Us.
Perfect. Yes, that's it, everyone.
I'm clicking Get right now, and the Aurora Health Alliance is, especially this year, focusing on health equity, and I think this is a great way in which we can help support the work of this program. So thank you so much. I will, if there are any questions, we know if they come in through the chat, you are available to answer, or otherwise we can connect following this meeting. Thanks.
Perfect. Thank you.
Final panelist is Dr. Loeb. So Heather, do you want to go, and are you guys tag teaming this presentation, Heather?
We are, and you can be our driver if you want to be our driver.
That's fine. It'll keep me alert. I have a newborn. I will stay awake during an afternoon meeting. This is an important one to stay awake for. So
can I ask a question?
Yeah.
Real quick. Can we steal that time? The additional time?
Frank's time.
Yeah.
Great.
Sure.
I like the way you're thinking, Dr. Loeb. Hi, everyone. I know see a lot of familiar names on here, and I see some new names too, which is exciting. My name is Heather Logan, and I work at CU Medicine, and I am also the chair of the Aurora Health Alliance. And I'll turn it over to Dr. Loeb for an introduction.
Hi, I am Danielle Loeb. I'm a primary care doc and associate professor in general internal medicine at University of Colorado. And I am working with Heather on a project to plan for and provide some care for unhoused folks here in Aurora.
Next slide. So a little bit of background. Dr. Loeb and I have kind of been partners in crime in trying to examine and further understand what homelessness really looks like in Aurora. So we've been looking at data, we've been talking to a lot of people. We've just been trying to understand, you know, pre-COVID, during COVID, and I don't even know if we can call it post-COVID, but in a more COVID-free world, how can we better meet the needs of unhoused folks living in our community? So we know that the unmet medical needs of unhoused population in Aurora is continuing to grow. We know that services are available, but they're not necessarily always well coordinated, and the left hand's not always talking to the right and how to ensure that we get those services for unhoused individuals. We know that there's a lot of Aurora partners that are health-based and community-based who want to do more and maybe don't know how, or not sure where some of those avenues are for conversation around how to better meet the needs of the unhoused community. And the impact of COVID, unemployment, and impending evictions that are going to start happening in Colorado are going to continue to drive that number up. So there's a huge impact on individuals at risk of homelessness or currently experiencing homelessness in Aurora. So we know that this is going to continue to grow, which means the medical needs are going to continue to grow. We know those medical needs are complex, and it's challenging sometimes for individuals to manage their health while living on the street. Next slide. So we know that all of us play a role in looking for solutions. And so there's a lot of things that impact individuals experiencing homelessness. And one of those pieces is healthcare. We know that's one piece of the pie. There's social determinants, I'm going to use Rich's term, of poor health or bad health, SDOPH, and need for a stronger workforce, unemployment resources, food resources. So we know that there's many issues and challenges and needs facing unhoused individuals in our community. And today we really want to hone in on the healthcare solutions and what we can do for healthcare in Aurora. This continues to come up as a top priority for the unhoused population in Aurora as we met with a variety of different stakeholders and partners. Next slide. So to date, Dr. Loeb and I have tag teamed and really tried to, again, collect data, do a lot of exploratory examination, and finding that there is good work happening, but it's tending to be fragmented. Not everyone's talking, and everyone's priorities shifted during COVID. So some of those initial collaborators that we've had some conversations with and are trying to brainstorm solutions with is Mile High Behavioral Health. They run the Comitis Day Crisis Center, the Aurora Day Resource Center, and they do a lot of street outreach here in our community. Colorado Coalition for the Homeless, the future Aurora Community Health Commons that will be in our community, City of Aurora, and I see Lana's on here today. Good to see you, Lana. Healthcare Policy and Finance, Stride and Salute, which are our FQHCs here in our community. CU Medicine and CU School of Medicine, as well as the Aurora Health Alliance. So we've started these conversations and brainstorm what could be. And again, we know that healthcare is only a piece of that, and there's only so much that we can do to provide that component, with those other pieces of the pie needing to be addressed as well. Next slide.
This is me, I think. So I'll pause here for just a second to say, I want you to put your sort of active brain on, please. And if you have a pen and a piece of paper, take it out, jot down your ideas, because we really, this is not a lecture. This is a, this is really, we're here to get your feedback, and that's why I wanted to steal the time. Don't worry, it's not for us to talk to you. It's for you to share with us. So one of the big things we're going to ask, this will lead into breakout groups. And so I just wanted to pause here to share that, so that, because this is part of what we're going to want some feedback on. So from what Heather has been sharing, some of these conversations, some of what we think our resources might be, early on, and how we could get something going and grow. We have sort of a short-term and then longer-term ideas. we also spent some time talking to folks doing some direct service to folks in the streets. And what we've heard a lot about is the need to meet people where they are. So that has fed into this a lot. I mean, that's really what this is based on. So our general notion initially is what someone out of Boston, actually, where they've done a ton of work with the unhoused, is talking about this as transitional care. So not urgent care as opposed to urgent care, and not transitional as in a week or a day or a period of time, but more transitional as in bridging, and that bridging could take a decade. You know what I mean? So not time-based transitional necessarily, but a sort of bridging role. So we've thought about a few components, and these are ideas that we want feedback on. These are not like we are doing X, Y, and Z. So there's a natural partnership with Comidas, the Mile High Behavioral Health. They have a day center where they do actually have space to have some kind of clinical operations. So our thought is, and there's a lot of people there passing through, is a short period of time on a daily basis, at least Monday through Friday, where we could provide some kind of more urgent care needs. So there would be a team with a medical provider, a medical assistant, and some kind of care management. They do already have a nurse there too. And that would be largely for some triaging, some wound care, et cetera. And also hopefully some real connecting to other resources in lots of formats, like primary care resources as well as other services. Then a street team, which ideally would be connected to another street team. So Mile High has a street team. Also, Colorado Coalition of the Homeless has a street team. There's complications to connecting with other people's street teams, but to provide the street teams out currently, to our knowledge, do not have a medical component, the ones in Aurora. So to be able to do some basic lab work for folks on psychiatric meds that aren't getting their labs, et cetera, some wound care, some of the similar stuff actually, as in the Aurora Day Center, just more mobile, likely in a specific place on a specific day. So Mondays at X, encampment, that kind of idea. And then to coordinate, we are working to really build as much of a connection as we can to the current folks providing primary care. So like Stride, and Aurora Health Commons, if possible, to develop some services, some actual connections, so we could get folks in, and then looking at the sort of respite, recuperative care for folks leaving the hospital, inpatient or outpatient. And then we have dreams of other future bigger things that I'm very excited about the notion of a mobile health clinic, actually. But maybe brick and mortar primary care clinic, addressing, expanding services, expanding how we can address social determinants of unhealth. Is that the phrase? And really envisioning being a part of a bigger conversation of connecting everything happening around these services, so there's more integration of everything that's already happening, and playing some role in that, being a part of that.
The future ideas that we're kind of thinking through, it might not be us doing it. It could be anybody in the community, especially meeting some of the social determinant needs. But we just want to start kind of getting a better lay of the land. And once we start to, coalesce all that data. We're happy to share it with the Alliance. Just really staggering the gaps we're finding in terms of the medical piece. And when I say medical, it really is inclusive of behavioral health, SUD, all of those different pieces that really are part of a multidisciplinary care team. It is something that we're just not seeing unhoused individuals having access to. Another thing we've done is talk directly to individuals experiencing homelessness to hear what their experience is like in Aurora and the challenges that they've ran into when trying to access care.
Great.
Another component I wanted to mention too is just, you know, the role that it plays with cost and the impact it has on our healthcare system, with a lot of individuals needing to end up, unfortunately, in the emergency room for a variety of things, or not able to get into primary care. And so some of their health needs get exacerbated, where then they have long inpatient stays and really challenging to get discharged back to the street. So we also identified, you know, a stronger need for transitions after a hospital stay.
I don't know what just occurred. Can everyone see these squiggles?
Oh, it just made it more fun. There you go.
So, there we go. This is a symbol of your thinking that is now going to occur. So sorry, I was trying to just pull up the chat and that occurred. So great. So I'm excited because we really want your feedback. And I was wondering how we were going to get it with the time we had. So we're going to break up into 4 groups. And Mandy is in charge of that, right?
Yeah, so Bobby Joe is our expert tech person working behind, and she actually in the chat asked me 15 minutes per discussion. Does that work? And we can check in, or do you want
a little more? Yeah, since we have more, if we could. So if people could come back, so this is my ask. So we could do 2 shorter breakout groups, but I think because we don't have that much time, I would like the breakout groups to be 20 minutes. And if folks don't answer, you don't have to answer all the questions if you don't want to. But what would be ideal is if you could, it'd be wonderful. And if there could be a spokesperson for each group. Afterwards, it's not the leader of the group, or not the representative of the Alliance in the group. And because I find that these conversations take usually 3 times as long as they're expected to take, I would love any written feedback. So I'll put my email in the chat, or you could put written feedback if your group ends up, like if somebody ends up taking notes. If you could plan to just paste those in the chat, it would be wonderful. The big one, we want answers to all of these. I really want answers to number 4.
Did everyone make it back?
Yeah. Amanda, send that name to me privately. Thanks.
Well, hopefully everyone had good conversations. Dr. Loeb, how did you want to, just rotate through groups? Do you think that'd be the most helpful?
Sorry, I was muted. Yeah, that'd be wonderful if the rep from each group wanted to share out. And then I was also going to type in the chat. You can comment to me privately, or to Heather privately, or to the group as a whole, any thoughts. And we'll sort of try to copy the chat. And
yeah, the goal would be to put all these thoughts and ideas together, and we'll make sure that those also get shared out later. So if you were in group, I think it was group 1, do you want to share some of your ideas and thoughts?
First, for the community partners, Aurora Mental Health Center was the main organization brought up by our group.
Put the contact information in the chat.
Yes. Allison, are you gonna drop that in right now again? Because what you sent was just for our group. But I copied and
Okay.
pasted. I copied and pasted it, so I'll drop it in the chat.
Well, most importantly, there's EJ Becker, who is the program manager for homeless services. I encourage you to connect with her, or I'll do an introductory email if you prefer.
I would love that. We would.
Okay.
I'll speak for Heather. We would love that.
So that includes Pathways to Home team. So that's definitely important for the Aurora community specifically. For what's not working well, the access to medication, behavioral health medication and therapy. If you're unhoused, you're often moving from place to place, not even staying within Aurora. You're going from one suburb, one like Denver to the next. So to get the consistency was a concern there. Yeah, a centralized location probably wouldn't work because people move around, and the transportation system in Aurora might not be ideal for the unhoused population. There was a discussion about the street team, how it is a good idea, but there was a concern about how to build trust. Is there people already embedded in that community that can help build the trust there? General curiosity on how many unhoused people are in Aurora estimate. And then if there are specific locations on where those folks are located. Is it like Colfax? Is it Parker Road and 225, for example? And then there was a discussion on if Jamie, can you talk about that a little if you're there? Jamie was had a great idea on just micro housing for that. And then that's the end of my ramble. Did I miss main points of our conversation group? Gina's shaking her head no, so I will be silent now. Thanks.
That's great. And I also want to highlight, that last question that was on the slide, because it keeps coming up for me is what is the role of AHA in this? And so there's been some talk from some individuals on, people that are passionate about this area under AHA having an ongoing discussion about it after even this meeting or a work group to continue the dialogue. We're the healthcare slice, but there's so many other components, that we're going to need to address. So I think, with the membership that AHA has and just all of the different areas that we work in the community, it'll be important for us to continue the conversation. So thank you to that group. That was great.
Yeah. Does number 2 know who they are? Or does some other group want to go? You can call, you can claim number 2, whoever you are.
I can go.
Erin is number 3.
Oh, I'm number 3. Okay, I'll wait.
You can go, Erin. It's okay.
Just to summarize what our group talked about, we were really in favor of the mobile primary care, and it was just seeing how it is pretty difficult. We just need really easy access for patients' physical and mental health. And when people need their health care, they need it right then. And so having this, we suggested having the mobile van be kind of readily accessible to the patients to go when they need it. We inquired about the pharmacy delivery system, what that would look like. And Dr. Loeb had explained that the coalition has some psych meds available on their mobile van to deliver, but also there's other delivery systems that other cities have used. We see the big need for kind of a systematic way for each of these organizations to talk with each other. And there will be a lot of strength through collaboration between the different systems. not be so siloed between physical health and mental health and primary care and all the different areas. Mentors or long-term case management will be helpful, because just for people to improve their healthcare literacy and to kind of remain, I don't want to say accountable, but just to have somebody to continue to encourage them to maintain their healthcare would be a good idea. And once this mobile care system, and Rich, I'm sorry if I'm butchering this last idea, but once the mobile care system is in place, then it'll be maybe a little bit easier to add on supportive services that can join the mobile van, like care management or mental health services. Hopefully it's there from the inception, but we can kind of expand once that mobile service is available. Did I get that, Rich?
Yeah, it was a great summary, Erin.
Okay.
Our eventual goal is stable primary care. It's
Yeah.
difficult now because we're just not together. But with the concept of a mobile care van, we start to build the building blocks in that direction, including really bringing in Stride and Salud to kind of work together with us, because they're our federally qualified clinics. This is their job. So let's bring them together and work with them. And they're both on the board as we start a work group here to begin to address the issues in homelessness and healthcare within the homeless community.
Great. You guys talked a lot. You guys got a lot accomplished. Great job. Julia, I don't know what number your group was, but is there someone in your group that'd like to speak, or are you the representative?
Sure. We were group number 4. I took notes, but please, anybody in the group, speak up if I forget anything. We talked about how there needs to be a larger cross-sector, not just the Aurora Health Alliance, but other folks as well. Lana Dalton, who I know had to hop off, but she put her email in the chat, was a great resource. She said there's a lot of projects right now going on in Aurora, working with people experiencing homelessness. So she suggested, include several agencies, health entities, behavioral health entities, criminal justice partners. I, of course, said, how about the regional accountable entities, since most folks experiencing homelessness have Medicaid. Hi. So we also talked about what Rich's idea of kind of expanding those resources through that mobile clinic. Edith brought up a great idea of offering economic empowerment courses to build skills for folks experiencing homelessness. Stephanie Phibbs also mentioned, the hospitals under the Hospital Transformation Program are working with people experiencing homelessness. So getting the hospitals involved would be great. We discussed some of the limitations include the limited number of beds, limited number of shelters, the need to work with the community to address these issues, to address NIMBYism as well. Stephanie had a great idea of creating a homelessness awareness day, since there's a lot of stigma attached to people experiencing homelessness, and doing an educational campaign. Kathy from Tri-County suggested getting the schools involved, and expressed how they are having difficulty finding places for COVID positive people to stay. Lana had reported that the city of Aurora has a contract to provide respite services for these folks, but there's not always hotel rooms available. So that was another frustration. And then another suggestion was expand respite recuperative care. And I think, Stephanie, you had mentioned a few other ideas that I didn't have a chance to jot down. So if there's anything I missed, please let me know.
Did great, Julia.
Thank you so much.
Great.
There's one more group, right?
We had a lot of similar ideas, which I think is refreshing to hear, that we're all kind of on the same wavelength in terms of some of our brainstorming. One of the partners that Dennis mentioned that might be helpful is the Aurora Chamber. They have the Ready to Work program with preparing individuals experiencing homelessness with getting a job and opening a savings account and really understanding how to kind of get on their feet. And they have 50 individual beds that they do for that. So they really try to set people up for success. Angie brought up really trying to look at other models that do this well. What are other bigger cities that have a larger homeless population doing? There was an article she referenced from LA where they're really dedicating money to do court-ordered housing for individuals. So I was going to follow up with her to get that article. So she recommended just looking at if there's a way for us to look at other models that have had some success. Identifying that, yes, this is healthcare, but housing is healthcare. It is a form of healthcare. So recognizing that that's a key component. Someone in our group, I think it was Zao, was it this you that said this? It might have been somebody else, that trying to find champions in the shelters or champions in the camps. There's usually a couple of people that really kind of know what's going on and working on that trust building that, yes, these services are safe. These people are here to help us. They're here to link you in with getting medical care. So really trying to find out who those champions are and spending the time to really get to know people and build trust with them. And then we talked a lot about the population that's just right on the brink, like who's really at risk of becoming homeless. They're not homeless yet, but we can't forget about that population. We might be able to meet the needs of individuals within shelters or people that are already on the street. But what about the folks that are, $100 away from being evicted and families that are really close to having to sleep in their car? So the at risk of becoming homeless population is another population that will need medical services. And then Dennis, I think it was you that was mentioned that it's important to have a comprehensive approach. And so really trying to think through and collaborate as much as possible, because we all can't do this individually. There's certain things that, we can do or provide within healthcare, but there's a lot of different slivers of the pie that unhoused folks need access to. So that was our group.
Well, gosh, thank you all so much. I'm aware that we have gone past our time. Thank you. This is really valuable, really, really valuable.
Hey, Danielle, can I ask you a question quickly?
Yes.
Do you feel as though the general population really has a good understanding what homelessness is and what it looks like?
No.
And I would agree. A little bit of experience I had with close to home work group that I was with, it was eye-opening that the majority of the population, what they see in downtown Denver or over by Parker Road and 225 is kind of what they envision homelessness to be. But the percentage of homelessness that exists in the suburbs, folks hopping from couch to couch,
insecurely housed, or
they're couch surfing, and it could be a mother and child, and so a lot of numbers are unknown. But from a marketing campaign standpoint, to identify, let's say, 5 different types of personas of what homelessness can look like. I mean, a divorce can push somebody that was above the line underneath, but a marketing campaign just identifying like 5 or 6 different personas and the faces of what that can look like, even though if they're not the actual faces, could be huge in gaining new resources and insights at the issue at hand, because it does appear though it's growing in just about every city within the urban and also the sections, and then the suburbs and the rural. So it's, like I said, it was eye-opening, and I don't think people understand.
Right. Agreed. There's a lot of different faces to it. Well, thank you so much, everybody. I know that we need time for community announcements. We're going to be putting some of these ideas together. I think there's definitely a role for AHA to play and a lot of other organizations around the table. So thank you for allowing your time and for us to dive into a deeper discussion around it. Mandy, do you want to kick off announcements?
For community announcements, I received one chat from Allison, if you're still
I am still
There you
here
are.
and eager to share. And I have a quick slide if I could just share a screen. Is that all right?
Sure.
Thank you.
And then if anyone else prep your community announcements, we'll probably go 1 or 2 minutes over 3:30.
So just wanted to share that that Connect Aurora is a program within the Aurora Mental Health Center, and we provide health insurance enrollment assistance. And the American Rescue Plan that was passed last March incorporated a number of very significant changes for health insurance for individuals, primarily in the individual health insurance market, and that is through Connect for Health Colorado. And so I just would like to emphasize that for individuals and households with incomes at 150% below poverty are eligible for 0 premium cost sharing plans on Connect for Health Colorado. That is a really big shift because normally these families, depending upon their age, would be paying something closer to 4 or 5% of their income. So this is a really big shift. Also, for the very first time, not only do people below 400% have increased financial assistance, and I'll show a chart, also for individuals above 400% of poverty, for the first time, they can get financial assistance. So I'll stress again, sorry if I jumped in too fast because I know we're short of time, that the individual market is primarily for people who are not eligible for Medicaid and do not have employer offer of insurance. And these marketplace financial assistance is available on Connect for Health Colorado, our Colorado state-based exchange. And so to give you a sense, one other really important feature is that households receiving unemployment insurance for even 1 week in the year in 2021 can also receive a $0 premium plan. So this is very significant. We're trying to do the outreach to get folks involved and to come back and either reapply or change their current enrollment. And so here is just a chart that Connector Health produced. Just goes to show that under the new rescue plan, most individuals will have anywhere from 30 to 50% decrease in premiums. So that's really significant.
Wow.
So I'd really like to if you could refer anybody you know who's in that market. And this just gives an example of a 40-year-old customer. This silver benchmark plan is 66 and they get that for $0 if their income is 19,000. So thank you very much. Our contact information is on connectaurora.org. And
Allison, as always, if there's any write-up that you want to include for us in our newsletter, we are happy to share that.
I'll get that to you today. Thank you so much.
Thanks.
Right. Then Allison, the open enrollment does end on May 15th, right?
No, it doesn't. Actually, that was one of the slides I skipped. Thank you for bringing it up, Rich. It is extended till August 15th.
Okay.
Any other community announcements? Thank you, Allison.
Thank you.
I thought there was going to be more. Thank you all for joining the Aurora Health Alliance quarterly community meeting. We will get notes sent up, set up, and next steps, and follow up with you all via email. So thank you so much.
Thank you.
Great meeting, everyone. Good to see you. Take care and stay warm. It's snowing.